really a pandemic, if one can throw that phrase around, in medicine that people don't really recognize or talk about that often, which is this explosion of geriatric onset debilitating brain disease. It most often, but not exclusively, represents itself as what we call dementia. And we tend to think of dementia as a single entity. And of course, that's not the case at all. There are many causes, there are many clinical presentations, and they cause immense suffering. As these illnesses progress from the earliest stage, they take a toll on not only the sufferer, but everybody around them.
How we approach that individual from a neurology forward, dealing with their dementia symptoms from that perspective based in neurology is cutting edge. Rather than treating it as a psychiatric problem, these people were happy, healthy, and at home until they weren't.
When they were diagnosed with dementia, everything changed. Then develop behavioral and psychological symptoms of dementia, or what we refer to as BPSD, and they begin to look very much like psychiatric patients. But they are not. Their symptoms are not really quite the same. They fluctuate a lot. So the paradigm shift is again understanding these are far more neurological, or what we call neuropsychiatric individuals versus psychiatric individuals. That might seem to be a minor distinction, but it's really, really not. It is a major shift in the way they are, again, looked at, understood, diagnosed, but especially treated. We let facilities know, and certainly we let the patients know to the degree they can understand, but most importantly, we let families know we can treat these behavioral and psychological symptoms of dementia. Your mom or dad do not have to continue to suffer in this way because there's treatment for these things. But I think it's very rewarding when you can bring to the process answers that really help and hopefully especially give families some comfort. We want the relationship with facilities and their staff to be a partnership. So I think the more that partnership is solidified, the more freedom staff feel to come to our clinicians with their questions, with their concerns, but especially for us, with their information about what they're seeing in that resident 24/7. We see these residents frequently and regularly, but it's a small window compared to the staff. So it is essential in developing an understanding of what's really going on with that resident that our clinicians and the staff are talking regularly and consistently.
We have a fully operationalized scheduling department. Every month, a week before the beginning of the month, a schedule goes out for that building. When someone calls into us as the corporate office, they get the scheduling department. That's who answers the phone. They can get our referrals, they can get the scheduling, they can get our communications person. And if they need something, they're gonna get them right there and then. So the reliability is 100%.
One of the key differentiators, I believe, that GuideStar brings in our neuropsychiatric and behavioral health approach to the buildings is that we have a unique 24-hour nurse practitioner on-call coverage. It is a live nurse practitioner, 24/7, monitored closely, that is able to speak to any crisis point, any time of the day. We are consistent. We are who we are. We come into the building. We serve the staff. We care about the resident. We provide bedside care, not telehealth. We provide education for the facility, for the staff, for the corporate team. We provide regulatory compliance. One of the things that we don't talk about a lot is that GuideStar is an age-friendly accredited entity. We are one of the only behavioral health entities that is accredited with this. And what does that mean? It means that every single note that we provide a facility is addressed individually to that resident to address what matters, what is their mentation, medications, and mobility. 4 key factors for residents.
It's a mission of the heart.